These are in listen-only mode.
Hello everybody. Thank you for joining us today for our webinar presentation on Caregiving Youth, Uncovering the Hidden Population. My name is Pip Marks. I'm the Project Director for Family Voices of California. And before I introduce our three wonderful speakers, I'd like to tell you a little bit about Family Voices of California and our webinars. These presentations are trainings on topics that are related to youth and children with special healthcare needs and the people who care for them. And our webinars attendees include families, healthcare providers, other professionals, parent-to-parent family resource staff, and advocates. So who are we? Family Voices of California is the state affiliate of the National Family Voices organization. We're a statewide coalition of locally based parent-run centers working to make sure that children and youth with special healthcare needs receive quality healthcare. And as the state affiliate, we are California's federally funded family-to-family health information center that provides statewide support to families of children and youth with special healthcare needs. So a few notes about the technology that we're using. If you don't have a headset for your computer, you can join us by phone by dialing in the number that you see on your attendee screen panel. And if you have any technical difficulties, please call the GoToWebinar number that's on the screen directly. And owing to feedback issues, we have everybody on mute from our end. Throughout the webinar, feel free to type in any questions that you might have in the little question box on the right-hand menu that you see, and there'll be time after the presentations to get your questions answered. So today's webinar is being recorded and will be available for viewing on our Family Voices of California website, either the end of the day or tomorrow. And after the webinar, we will be emailing you a very short evaluation survey. We really greatly appreciate any feedback that you can give us, and you'll see that in your inbox. So now it's my pleasure to introduce today's speakers, Dr. Connie Siskowski. Connie was educated at Johns Hopkins and New York University and earned her PhD in 2004 from Lynn University. Her broad background in healthcare and dedication to diminishing caregiver struggles led to the 1998 establishment of a non-profit organization which has transformed itself to become what is now known as the American Association for Caregiving Youth, which is headquartered in Boca Raton, Florida. So thank you, Connie. And Dr. Julia Belkowitz, I'm sorry, Julia, is currently on the faculty at the University of Miami Miller School of Medicine, where she works at the Regional Medical Campus. Julia serves as the Assistant Regional Dean for Student Affairs and the Regional Campus Clerkship Director for Pediatrics, through which she works with medical students in the 4-year dual degree MD-MPH program. Julia also serves on the advisory board for the Caregiving Youth Project in Palm Beach County and has collaborated with the American Association of Caregiving Youth to conduct research to better understand the needs of caregiving youth. And Dr. Rami Asaf is currently the pediatric resident at Children's Hospital of Los Angeles with a great interest in health advocacy. Rami completed his medical and public health training in Miami, Florida, where he led a performance art-based health intervention in the inner city. Rami completed a program evaluation with the American Association for Caregiving Youth and helped raise awareness at the National Conference of the American Academy of Pediatrics in 2014. Rami is currently leading a Caregiving Youth project in collaboration with multiple clinics at the Children's Hospital of Los Angeles. So now it's my pleasure to pass the presenter role over to Dr. Belkowitz. Julia, it's all yours.
Okay, thank you. Let's see. Are you able to see my screen?
Beautiful.
Okay, wonderful. Thank you very much, Pip, and hello, everyone. It's afternoon for us here, so good afternoon. And we all really appreciate the opportunity to talk with you today about Caregiving Youth. As Pip mentioned, the title of the talk today is Caregiving Youth, Uncovering a Hidden Population. And that's because this is a really understudied and under-recognized and acknowledged population. While caregiving in the adult population has been acknowledged as a public health issue for quite some time, the group of children who are taking on this role is really something that needs a lot more attention, and we hope to begin to uncover a little bit about that today. So today, overall, we're going to start by introducing what is Caregiving Youth, talk about the statistics that we have, as well as those that we don't have about this special population, and begin to discuss the impact that caregiving might have on our children. Dr. Siskowski is going to take over after me, and she's going to introduce the Caregiving Youth Project, which is the only of its kind in the United States. It's an organization whose sole goal is really to support these caregiving youth. We'll also consider the role of healthcare providers, parents, and advocates, so all of you on this call, and really helping to bring attention and support to these children. And then finally, Dr. Asaf will talk about the program that he's running at Children's Hospital in LA as really a clinic-based model to think about how to address caregiving youth. So this is the first important point, is who are caregiving youth? And these are children and adolescents who are less than 18 years of age who provide significant assistance to relatives or household members who need help due to many different reasons. It can be physical or mental illness, disability, frailty associated with aging, substance misuse, and other conditions. And as a pediatrician, I can honestly say I had never actually formally thought about children as caregivers or taking on that role until I was introduced to the Caregiving Youth Project a few years ago. And at that time, Dr. Siskowski shared a quote with me that she had from another pediatrician that she had heard, and that how he explained it, that until he'd met her, his focus had always been on the child who was ill and not on his brother who had been suctioning him. And I think that really resonated with me, that it's something that's, if you think about it, of course, there's so many children that are taking on this role but maybe not getting the attention that they may need. When we think about trends worldwide, it's important to talk about this before we talk about what we know about children in the United States, because other countries have actually been acknowledging and supporting these caregiving youth for decades, actually, some as early as the 80s, certainly the 1990s. And so we are really behind when we look at many other countries in the world. When we try to understand the prevalence rates, it really does vary because there are different definitions in different countries. But overall, it's estimated, as you can see here, between about 2 and 12%. And what we definitely see when we look at the data from other countries is that the numbers of caregiving youth are increasing. The United Kingdom measures their data about caregiving youth actually through the census. And the Australians are able to measure, they actually provide funding to children to kind of help support them in their caregiving role. And they've seen, both of these countries have seen significant increases in the number of youth who are seeking support or identifying as caregiving.
And so
we don't have...
comment, this is Dr. Siskowski, and that when caregiving is looked at in the census, parents are not always aware of the role that children are playing in the healthcare delivery system, and so therefore there's feeling among most researchers that this number is underrepresented.
Mm-hmm. Thank you, Connie. And along that same line, we certainly believe that the numbers are increasing in this country as well. As we look at trends that change here, we have more grandparents raising grandchildren. We've had many changes in the economy, shifting of medical care into the home, and so we believe that these numbers are increasing here as well. So when we think about the trends of caregiving in the United States, it's important to understand that there's a lot of limitations. The epidemiologic data we have is really limited to one study that was done now over a decade ago, and we really don't have other mechanisms to track and identify caregiving youth through existing data sets, such as medical records, census tracking, and even the national caregiver support programs that are available for adults. Children are excluded from these areas, so we don't even have a way to kind of count to people that may be asking for support. There's a lot of different ways to address this issue, but one thing that we are looking at is helping to increase the ways of identifying children in the medical setting. And so we have submitted a resolution to the American Academy of Pediatrics requesting that they provide more attention, research, and guidelines about screening for caregiving youth. And these this resolution is still under discussion by different committees. But it's important to understand that there is a lot of missing information when we think about these children. So to start for a minute and think about what we do know, we were going to go through a little bit about the epidemiology and demographics of this population, the responsibilities that the children take on, as well as the impact as best as we can describe. But it's really important to understand that there are major gaps in knowledge in each of these areas. And for those of you that might be interested, there's just a huge opening for research about all of these important issues. And just to kind of reiterate how it compares to the understanding about caregiving in the adult population, if you do a search for adult caregiving, you'll find thousands of articles that come up. We are part of a coalition of Caregiving Youth. It's called the Caregiving Youth Research Collaborative, and some of our colleagues in this coalition recently did a review article looking at all of the studies in the United States, and there were only 22 articles about caregiving youth in the United States that they identified for their review. So there's certainly a huge opening for people who want to learn more. So as we look at the epidemiology, the main number that we get, that we talk about, is that there's at least 1.3 million children who serve as caregivers in the United States. This is old data. This study is based on a survey of U.S. households that was done all the way back in 2004. And unfortunately has not been able to be replicated since then. And as I mentioned before, we really believe that the number is probably much higher. To kind of help put this number of 1.3 million caregiving youth in perspective, if you do a search for the number of foster children in the United States, which is a very recognized population, really comes out to be about 500,000. So this is the numbers that we have show that this is really an important issue. And you know, having more attention to this issue is a key priority for our Caregiving Youth Research Collaborative. And it's a very interesting group of people to show that there's a role for really anyone who wants to get involved in this, because the disciplines represented in our collaborative include those in geography, social work, psychology, medicine, and so many different areas. So it's really a way to show that this issue impacts many different disciplines. But as we move forward, we really...
Well, Julie, I just wanted to mention too that the statistics for the number of foster children represent foster children of all ages, whereas the 1.3 million is segmented ages 8 to 18.
Yes, that's very true. You know, as we look at the other statistics, other ways of looking at it are thinking about how many children are exposed to caregiving. And so we know about about 40 million adult caregivers in the United States, that 37% of those households report having children less than 18 years of age in the house. So it's not that all of these children are necessarily caregiving. We don't know the answer to that question, but it certainly leads us to wonder what role these children are taking on in these many households. And our team together here on the phone conducted a study based on records of the Caregiving Youth Project in Palm Beach County that you're going to hear more about from Dr. Siskowski in just a few minutes. But in that program, basically 2% of sixth graders who were enrolled in the participating schools in Palm Beach County, Florida, ended up enrolling in the project. And about 22% of them were eligible for services based on their initial screening that's done through the schools. So there's certainly many children out there that need support. Again, as we looked at our study and looking at the demographics, we looked at the intake forms of children as they entered the Caregiving Youth Project program, almost 400 children that were enrolled over these years, and that continued to be active during the time of our data collection, which was in the spring of 2014. There were some limitations in this study that show that we, again, need more research. But these were data based upon the usual program evaluation and program records, not necessarily collected for research data at the time. But it gives us a good clue into what these children's lives are like. The median age of children when they enrolled was 11 years of age. That's probably not too surprising, given that the children were sixth grade when they are screened. But what I think is surprising is that it shows you that these children have probably been taking on this role for many years before, if they're already self-identifying at age 11. And this has been found in other studies as well, that children at very young ages begin to take on the role of caregiving. The racial and ethnic demographics that are shown here likely represent the demographics of the schools at which the children attend in our community. Other studies have shown different patterns, including patterns with a majority of white Americans, and I think the most important take-home point from this is that all children really can be impacted and take on this role. When we look at who children are caring for, most children are caring for grandparents, although there are many care recipients, and about 15% of the children reported that they were caring for a sibling. It's important to note also that 19% reported multiple care recipients, and this is something that the Caregiving Youth Project has been noticing has been increasing more and more over time, that children are not just caring for one person, but many people. When we look at what the children are doing, they're taking on very significant responsibilities. About 45% of the children reported that they were assisting with mobility. The majority of children take on the role of providing emotional support, keeping company for their loved ones. And some of the things that they take on really require specialized training. So as you can see, for example, 25% of the children report translating at medical visits, which can impact both positive and negatively, of course, but it has a big impact on parent-child relationships and dynamics, mental health, and self-esteem. And the diversity and complexity of the tasks that we saw here is very representative of what's seen in the other studies. Another important area to note is that 36% of children reported that they assist with medication administration. And this is an area that had not been previously explored, and now is an important area that we are investigating further to really understand the circumstances surrounding this in terms of the impact and role that children are taking on. And we're actually going to be presenting, this is really groundbreaking research. It's never been presented or studied before at the Caregiving Youth Institute conference here in Florida in April 2017. When we look at how much time children spend caregiving, it's interesting because the children and parents were both asked this question, and actually the parents reported a little bit less time, fewer hours than the children themselves. So the children report spending about 2.5 hours during weekdays and 4 hours on weekends. And we're not sure if this difference that we see is due to a lack of understanding of parents of their children or just a difference in how the data was collected and reported. But either way, it's really important to note that these children spend quite a great deal of time caregiving and thinking about what they're not doing in that time that other kids may have the opportunity to do, whether it be activities, sports, or just being kids or having time to focus on their work and their own growth. At intake, the children in this study were asked 2 questions. How healthy are you, and how do you think you're managing with school and outside activities? And it was interesting because children generally reported being healthy and feeling good about their caregiving, although we did not do formal assessment for mental health because that's not the model for this project, which is a non-medical model. This is definitely different than what's shown in the adult community, where it's clear that caregiving is associated with significant burden, sleep deprivation, depression, anxiety, increased risk for mortality, and many other things. And other research on the literature about children as well shows that the outcomes aren't necessarily very positive. One thing that's not explored, but it's important to think about, is what are the impact on the physical health of children. As we mentioned before, 45% of kids are assisting with mobility, and we wonder what is the impact of these important physical tasks on their bodies as they're still growing and developing. And also makes me question.
Yeah, I was going to comment that one of our very first families, the mom was heavy, and the youth caregiver, who at that time was 9 or 10, really hurt her wrist from pushing her mom in the wheelchair.
And that leads to the other question of, how are children addressing their own sick care and their own well care? Is their own health, put to the side while they're caring for somebody else? And again, this is an important area for us to learn more. In terms of education, the studies that we show that more than 1/3 of children report that caregiving affected their academic performance, missing days, not being able to get their work done, not being able to participate in outside activities like other children. And as we know, this impact on education has potentially lifelong effects and implications for these children. So it's important that they're able to continue through school, which you'll learn about next is a big part of the Caregiving Youth Project. And then when we do look at what we do know about impact on mental health, it's clear that adverse effects on mental health have been identified in both the U.S. and international studies, although it certainly does remain an important area to learn more. But these children are at risk for anxiety, depression, isolation, being stigmatized, and feeling very alone. Oftentimes, if their loved one passes away, they may not be prepared or understand that that was coming or how to react. And we also have to think about this concept of parentification when children are taking on roles that are really beyond their developmental stage and beyond their typical role in the family, and what is that impact. It is important to understand that there certainly can be benefits to children, especially if they're acknowledged for the important work that they're doing and that they are feeling appreciated for the help that they give to other people. They certainly have a lot of maturity and compassion and can have very special relationships with the person that they're caring for. And in fact, many of the children in the Caregiving Youth Project actually express an interest in going into healthcare professions as they get older. It certainly gives them a sense of purpose, and if recognized, can actually help their self-esteem. And so it's really important that we understand the factors that lead to resilience, whether it be family mechanisms or other social supports, to help to maximize the benefits and minimize the burden that we see. And for that, I'm going to pass on to Dr. Siskowski so she can talk about the role of the Caregiving Youth Project and exactly how they're working to help improve the lives for these children.
Thank you, Julie.
Thank you, Julia. Dr. Siskowski, did you get your little, it's over to you.
I did.
Good.
So, but now, let's see. But of course I hadn't gone back. Can you see it now? Can you see my slide?
Yes. Can you enlarge them?
No. Well, on my screen it's large. Let's see. Let me go back to what Julie had suggested before.
Unclick.
To use presenter view.
No, unclick your presenter view, and then you can go over to us on the beginning. Is that better? No, you need. Do you want me to do it from my end?
Sure, go ahead.
Okay. Sorry, I'll just pull up your.
So while we're in this process of transition, everybody's in transition, the American Association of Caregiving Youth officially began on January 1st, 2010, after beginning the Caregiving Youth Project in 2006. Our organization began as a nonprofit in 1998 to provide volunteer support services to people who were homebound and caregiving families. So we've always served people of all ages and all types of conditions. Next slide. Pip, can you go to the next slide? So, are you on slide 2, Pip? I'm sorry, my screen is off.
They're not. Oh, I'm sorry. I'm on. What is AACY, the American Association? And then the next slide. The next slide is.
Yeah, now I'm back.
Okay.
Okay. So Julie has. You can go back, forward it. It's okay.
Okay. You're on the trends, changing population.
Yeah. So, as Julie already mentioned, there are many factors that provide sort of a petri dish for children to be caregiving in families, and certainly one has been the economy, with both parents often having to work and then care being pushed to the child. Certainly we have more women working and many more single-parent and multi-generation households. So if you're a single parent and you have a child who is disabled and you have a child who is well, then, and as a single parent you need to work, you really need that support of the child who is well to help with the care of the child who may be disabled. We're also seeing more grandparents parenting the second time around. And once again, if grandparents become ill, it provides the opportunity for children to participate in care. And certainly, as we have seen more managed care, we have not seen an increase in home care. And many of the families of caregiving youth are financially insecure and therefore do not have the resources to hire additional help at home. And we all know that because of advances in technology, complex care can be delivered at home in ways that it never was in previous years. We also see that as our population, especially in Florida, but really throughout the country, has changed, that culturally there is more of an expectation of children participating in care. Just this morning, I was speaking with someone in the Veterans Administration, and finally they are beginning to look at teens who are caring for veterans. So we're really excited about that, because once again, this is another population, and just because a person is a veteran and may have had an injury doesn't exclude the rest of the family from potentially having other health conditions. It doesn't mean that if the vet is injured and returns home, that one of his children or her children couldn't have a disability, or maybe a grandparent has moved in to help and then the grandparent becomes ill. So just all kinds of situations. Next slide. So as an example, this is Alexa, who is caring for her sister with special needs who has a GI condition. So she has a G-tube. She also has a respiratory ailment. And Alexa has an older brother with a disability as well as a younger one with ADHD. So her parents, in order to try and feed the family, have a dog grooming van, as well as some facilities to board dogs to try and help with some income. But Alexa has really suffered academically, and we have been able to provide her tutoring as well as some other supports so that she can achieve academically as well as personally. Next slide. So back in 2012, I was nominated as a CNN Hero and became one of the top 10. So this happens to be some of the kids that were photographed and videoed. Unfortunately, we wanted to show you a couple of videos from that time, but we weren't able to get the proper connection. But I would like to share about Mandy. Mandy is the child on the left, and she was caring for her brother Isaac, who had multiple disabilities. Her mom worked, and she would be there when he got off the school bus, and which was in a wheelchair. And one of my deficiencies after doing a home visit is because I didn't realize that Isaac would keep growing, and we work with the children from 6th grade through high school graduation. And as Isaac grew, his small wheelchair was no longer able to fit through the doors, and they wound up with a hospital bed in the living room in order to provide care for him. So that was, quite a learning experience. Just to show you the variety, the girl with the glasses, her mom has had breast cancer 3 times, ovarian cancer once, and although she's in remission right now, it's always in the back of her mind that, this could come up again. So even though she's not actively doing a physical task for her mom, we are there to support her. Chris, who's the boy in the front, was named Person of the Week back in November a couple of years ago by Diane Sawyer. Chris is one of those children being raised by his grandmother. His mom died when he was younger, and his father was in and out of jail. And one day Chris came home from school and found his grandmother in the backyard. So that really has impacted him, and I am really happy to say that he is doing well in school now. And we have a new partnership between ADT, which is an alarm company, and State Farm to provide medical alarm systems. And so we're trying to do everything we can to relieve the stress on children so that they can be fully cognizant and stress-free as possible when they're at school to learn. And the boy in the back, Nick, his mom had HIV, so she was a single mom. His dad had died, and when we met him, she was in bed in the living room, and she ultimately did pass away. But one of the things that we were able to do was to connect him with a family who had boys, so that at the time of his mom's passing, there was an easier transition for him. So when we encounter situations like that, where we know that a parent or grandparent or whoever may be terminally ill, that we do try and make those arrangements ahead of time to make the transition as easy as possible, considering the circumstances. Next slide. And then this is Cassie feeding her brother. And Cassie has been a caregiver for a long time. Unfortunately, she is one of the ones who was impacted physically, and as a result missed school and was not able to graduate on time. She was our one person from last year who wasn't able to graduate, but now she is getting her GED. So the impact on children is real. Next slide. So we've talked about, Julie talked a little bit about the academic challenges. There was, I don't know if any of you ever saw this great commercial that said, when you're worried about what's going on at home, it's impossible to think about anything else. And that's what we really see with the kids. It's hard to focus when you're worried about what's going on at home. So not only the possible for physical injuries, but we have heard from nurses that caregiving youth are more likely to go to see the school nurse. And we're also working to try and get them in caregiving youth included in ACEs, adverse childhood experiences, because it's traumatic. If you find your parent in the closet when you come home from school who has fallen and can't get up, as recently happened to one of our students, or to myself as a youth caregiver, I went to give my grandfather his medication at 2 o'clock in the morning, and I was the one who found him no longer breathing. And it was really at a time when trauma was not well recognized among children. As Julie also mentioned, it's hard, you know, if the sibling is on the autism spectrum and may have behaviors that other people don't understand. We see that the children, sometimes as a way of coping, the siblings, that is, tend to isolate themselves and don't feel comfortable having friends over. And so they become more isolated. In fact, when we had our first camp, one of the boys whose sibling was severely disabled, and the family had to pay attention to him, had isolated him so much that when he was at camp, he had a hard time accepting that we were there for him. So we do a camp and other activities to try and replace some childhood that's lost. Next slide. So this was some art that says it really well by one of the kids. It can be hard or it can be easy. It all depends on how you look at it or how you handle it. So we can't change the condition of the care receiver. What we can do is work with a student to change how they handle it. Next slide. And also, as Julie had mentioned, there are many rewards. There's compassion. There's a whole national effort now to teach children empathy, and caregiving youth have empathy in spades. And often they don't realize until they're ready to graduate how much more they know in terms of life skills than their peers. Next slide. And so the Caregiving Youth Project serves kids in school, out of school, and at home. We do skills building groups, lunch and learn, and the lunch and learns are open to all students and school staff. We bring in community resources. We do a home visit to make sure that the families know what resources are available. Many families today don't have computers, and if you have to get right home from school, you can't stay after school to get special help with tutoring. So we have even provided some in-home tutoring and looking at special needs, such as families not having clean water, and making arrangements so that that gets taken care of. As I mentioned, we try and give kids a chance to experience some childhood. We have an overnight camp called Camp Treasure because we believe these kids are a treasure, and to help them discover the treasure within. Next slide. So everything we do tries to ameliorate some of the ramifications. And this slide, which will also be on a link after this, were some questions. You can't read them very easily in the kids' handwritings, but we do an educational session at camp, and this was just done last weekend. And I think, you know, the kids really raised some poignant issues. If you help someone with medicine and you give them more than what you need, which meant they need, will it harm them? How do you remember that a person has problems but looks like a normal person? How can I get someone out of bed if they don't have anything to help them? And when you lost your loved ones, will it affect your life? What happens when they need help but you can't help them? What can you do? I tell you, these are questions that we could not have made up, and these are from 6th graders. So I hope that this raises or shines a light for you on what some of the issues are that these children are dealing with. Next slide. So at the end of the school year, we do an end of the year survey, and these are the results where you can see the scores are high. Not all students receive all the services, or not all families receive all the services, but you can, you know, just knowing that they feel better about themselves, that they have the knowledge and skills, and that they're able to manage stress, and that their own health has improved. We're very grateful and work hard to achieve these results. Next slide. So as Julie mentioned, on April 27th, we are having our second conference for the Caregiving Youth Institute, and the 4 tenets of the Institute are connection, advocacy, research, and education. And one of the things that we really need help with and invite you to join us with is to be able to change some legislation so that these youth who are part of our healthcare system are recognized and valued. Next slide. And so these are, we work with people from 8 different universities around the country who are all part of the Caregiving Youth Research Collaborative. And you can continue to the next slide. And so these are some of the ways that you can help to raise awareness, to help identify student caregivers in your setting, to help us work for system change and collaboration, because it's really healthcare, education, and the community that must come together to support this population. And actually, we, in promoting legislation and to have these children recognized, we really want to end reverse age discrimination. The children can do the same thing as an adult and yet receive no benefits or recognition. Next slide. I think that should be it. Yep. So it's the right thing to do to support these children. And now I'm so pleased to hand this over to Rami.
Connie, thank you very much. Over to you, Rami.
Just want to say thank you so much. Thank you for everyone for being here, for taking the time out of your busy day to come and attend this webinar. I'm really humbled that you can be here and also that I can speak amongst two of my really great mentors. My hope is really to show how caregivers can be identified in the hospital or clinic setting, even with limited resources. So my name is Rami Asaf. I'm a resident physician here at Children's Hospital Los Angeles. This is where I work. You can see downtown Los Angeles in the background. I'm a current second-year resident here, and you know, I went to medical school at the University of Miami, and while I was a medical student, I performed a program evaluation with the AACY, and then basically adapted their model to introduce a caregiving youth study and an intervention here at Children's Hospital Los Angeles, or CHLA for short. But I often get the question how else I got involved in the special population. And for me, it began while I was living in Miami. I'd been very fortunate to introduce an intergenerational public health message that was linked together by stories of locals living with chronic diseases in the city of Overtown, which is part of Miami. This was a great project. It was based on community-based participatory research, and the way that we went about introducing both film based on individuals living with chronic diseases in Overtown, a particularly neglected area of Miami, and combining those with performance arts was, I had the opportunity to meet a local sports hero. He was very invested in the community, and he had just recently helped open up a recreation center. After talking with Mr. Washington, he had introduced me to individuals in the community that had agreed, basically consented to being filmed as part of a documentary to explain what it's like to live with cancer, what it's like to live with diabetes and to be on dialysis. And then we took those videos and we held a casting call that was led by a local film director by the name of Elijah Wells. We casted several young participants, and they watched these films of older adults in their community talking about you know, certain vulnerabilities living with chronic illnesses. And then we had the opportunity to discuss basic science of diabetes and cancer with these children. And then what we had done was we held weekly dance and performing arts practice in a little place called the 6th Street Dance Studio, which was owned by Bridget Baker. She's a choreographer and dancer from New York who had trained under very famous choreographers and dancers like Pina Bausch. We then combined those series of documentaries with live performance arts, and in the form of acting, in the form of music and spoken word, and this was the result. These are certain clips from the documentary of individuals speaking about what certain conditions they were living with, and the day of performance that we have here with the talented individuals. On the bottom you see Elijah Wells and Mr. Washington. So I was very lucky to basically be part of this process, and that had led me to ask more questions about caregiving, because that was a topic that had come up. So that takes us to our current project here at Children's Hospital Los Angeles. Basically fast forward a few years. So this has two parts. There's a descriptive study and there's an intervention. The descriptive study is, number one, based on defining the problem. So what is the demographic information of child caregivers that we're able to identify in our hospital and in our clinics? And what types of roles do they hold at home? Specifically, what types of tasks are they performing? And what is the impact on their lives, psychosocially and academically speaking? And the second part is an AEP Catch Grant funded intervention based on focus groups and caregiver skills building workshops. And I'll be able to walk you through this next section here. So starting with the screening survey. It's an IRB approved project that was introduced last year. We are surveying in 3 different clinics as part of our hospital, in our medical home, which is part of an FQHC, a federally qualified health center, where we, as residents, have our continuity clinic. The second clinic in which we survey is the spina bifida clinic, and the third is the pulmonology clinic. So what do these screening surveys look like? This is it. This is all that we ask. I designed this to be as brief and to the point as possible, and to be introduced in these 3 participating clinics. So these surveys are integrated into social work and medical assistant evaluations that are already being performed in the clinic, so as not to add too much work to our clinic staff. And also we do have flyers that are distributed to let families become aware that this is a project that's going on. If there is a family that screens positive and answers yes to these questions of having a caregiver at home or a potential caregiver, then they are given a consent form and study information, and then asked if they would like to participate in a secondary phone survey. So this is the portion that I perform, is the telephone-based follow-up survey, and it's held with both a parent or a guardian and the caregiving youth. So this is the portion that I discuss with the parent or guardian. This gives me a good idea of the demographic background of the family, starting with just general zip code, ethnic background, the caregivers received all their vaccinations, who they care for in the family, their age and diagnosis, and some basic social work related questions that touch on any of the issues that the family may be concerned about. If you look at some of the research on caregivers that come from families, more often than not they will come from families with lower socioeconomic status. As part of that same survey, the second part is the part that I conduct with the child. So I'd like to mention, however, that the child, in the cases that I've held this conversation over the phone, I hadn't met them before. It's usually the first time I meet them over the phone. And the reason is caregivers or child caregivers likely will not come to the clinic with their sibling or their cousin and be there with their parent. They might, but it can't be guaranteed. And my guess is that's likely less than often. So these are the questions that I ask them. The first are a series of ADLs, activities of daily living, and the second series of questions are related to IADLs. So I ask them things like, are they helping with feeding their sibling or cousin or extended family member? Things like taking them to the bathroom, continence care, dressing, assisting with mobility. And you can quickly look at the rest of the tasks they might be performing there. And it is important to note that they may not be caring just for one individual, similar to what the findings that came out of a study out of Boca Raton in Florida. They may be caring for another individual in the home, whether it be a younger sibling with no medical issues at all, or someone older in the family. And this is the last part of the telephone survey, in which I ask about the impact. So I want to get an idea of what are the hours that are spent caregiving on school days, weekend days, and during the summer, as well as any difficulties completing schoolwork, being late to school, as well as emotional impact of caregiving. So we use 2 validated brief depression and anxiety scales, and there is a standard operating procedure in place to refer a youth who identifies as being significantly depressed or anxious to a doctor or a social worker. So I want to speak briefly to our intervention. Before I do, I just want to mention that that whole survey process takes about 15 to 20 minutes over the phone. The intervention began and is continuing to branch out from coalition building. So at this point, about a year and a half into the project, I've held discussions with caregiver and family resource organizations in the Los Angeles area that are interested in the work here at Children's Hospital. This essentially is a pilot study, and coalition building should evolve alongside the study itself and well into the future. The intervention, as I alluded to earlier, contains a focus group and caregiving workshop and followed by a program evaluation. The caregiving workshop itself, as I mentioned, is funded by the AAP Catch Grant. It brings together 3 different disciplines: nursing, child life specialists, and social work. So nurses who are interested in conducting these workshops, they perform home-based care strategies, essentially, with those who are attending the workshop. They would essentially ask questions that may lead a group of children to respond. What is the best strategy to care for a sibling or a cousin at home? So leading question and answer sessions similar to what Dr. Siskowski had introduced earlier on, to these questions that we would not anticipate that child caregivers would have, and really identifying when to call for help. And now child life specialists, who are really child psychologists, are able to help out with stress management, as well as a school and work, or in this case, school and caregiving balance, work-life balance. And social work, as being part of these workshops, may help identify some of the needs, or further identify some of the needs at home that are related to the home environment and family, as well as referral appropriately to community resources. So talking about the focus groups and program feedback, this is really the beginning and the end. So the focus groups are at the beginning of the workshop. We're interested in learning more about what are the attitudes and experiences of caregiving youth. What is their perceived impact on their life? What about things that they derive as benefits of caregiving? Feelings of self-efficacy, and what is their own access to medical care? And at the end of the workshops, what are some types of program feedback that we're able to derive in the sense of knowledge and skills related to caregiving, school performance, and physical and mental health that we may identify along the way. So just wrapping up, I would like to stress that child caregivers are really part of the medical home. So here in LA, what we're doing is we're advocating for not only screening in clinic, but for recognizing the child caregiver's role amongst complex pediatric patients that come to a tertiary healthcare center like ours, and identifying the needs of their families. So once we recognize the child and minor's role in home care, how does that really affect how medical providers address issues of care coordination as part of the medical home? Moreover, how does it affect how we tailor family support services and resources in our clinics? And that simple recognition of identifying caregivers and their role may lead to a greater understanding of the psychosocial impact of caregiving on very young shoulders, similar to the parentification that Dr. Balkowitz had alluded to in her slides. And overall, this is an area to be explored because the total scope of young caregivers' work in the U.S. is, as we've seen, is as of yet to be completely defined. And lastly, I would like to stress, I would hope that this inspires individuals to build coalitions and to help identify caregiving youth, but to be wary of the very real logistic and psychosocial barriers that are part of just asking very simple questions, or that would seem like very simple. So just logistically, there's the constraints of clinic time and space. There are issues of how to distribute surveys and how best to do that while maintaining privacy. There's the fact that caregivers oftentimes will not be present in the clinic, so a lot of these questions are being directed to directly to the parent or guardian. But, however, there are concerns of the stigma associated with asking these types of personal questions in the home environment. There's a fear of information sharing, certainly, that has not really been comforted in this post-election period. And there's a concern of what is the personal benefit, should families participate in these types of workshops. So realistically, these issues must be addressed when designing a survey and an intervention, wherever they might be. And I just wanted to end with this particular slide, but also I wanted to reinforce how important this type of work is, and I hope that it continues to spread throughout different counties, different states in the United States, and to say lastly, and really recognize the work of Dr. Siskowski and truly how groundbreaking it is in this country. So here are our references as part of this presentation, and I wanted to end just with a personal thank you on our behalf to all those who attended once again, and really to welcome all your questions and suggestions and concerns, and I hope this could be a platform really for further advocacy in the future.
Thank you so much, Rami, all of you, for fantastic presentations and all the work that you're doing. It's very heroic work. So do we have any questions? We have a few minutes, and I know if questions come in and we need to go over, I can always email your questions over to Julia, Connie, and Rami too. Sarah, are you on? Do we have any questions, Sarah? Not yet.
Hi, so I had to unmute myself. Doesn't look like we have any questions at this moment, or any hands raised. Actually, I see one.
Oh, thank you. What work, a question for, I think all of you actually, what work, if any, have you done that intersects with supporting parents with disabilities?
Supporting, I would just like to clarify that. You mean supporting if a parent has a disability, and what have we done to support the children who are caring for that person?
Yes.
So actually we work with all of our families the same way, and so if a person has a disability, again with a home visit to connect them, to provide respite, to make sure that they have existing resources, have access to medical care. We have really fostered independence by providing some families with ramps so that caregivers don't have to lift them in and out of the house, and other safety measures, as well as the medical alarm systems, which are really a benefit not only to the child, who is now relieved of some stress, but also for the peace of mind of the care receiver or the person with disability.
Thank you. The person asking the question just also commented, says, it seems that supporting them would also support the youth. I work in this area and we actually see the assumption that youth must be caregiving as a challenge, meaning that when a child without a disability may be staying in providers assume that the child is caregiving when they may or may not be the case. Which may, I'm not sure if you understand that comment.
Yeah, I don't really, but I can say that the more we can strengthen the family, less a burden there is on the child.
Right.
And if there are any follow-up questions, you have our email address, and we'd be happy to take those.
Yes, this person says, thank you, I agree.
Thank you.
Julie, did you have something to add?
I was just going to say, I think the comments also reiterate the importance of asking those questions and finding out, and asking the children, asking the families, what are they doing, and not to make any assumptions one way or the other, but it's important to take the time to explore those issues with the family together. Yeah. And find the best supports as possible using available resources in the community.
Well, that brings me to the next question. Somebody is saying we need this program in our area. How do we start?
So you can start by contacting me, and we can see, I have a whole list of people from different parts of the country that would like to begin. Our typical way of developing an affiliate relationship is to partner with an existing nonprofit. So please let me know who you are, and I'm happy to be in touch.
I will send well, your email's on the screen, but I will send that contact information out. By the way, everybody, Connie did send me some excellent documents that I will be emailing to everybody, as well as the link to the video that she had hoped to show. One more comment. It's from Phelan Lewis. I think says, hi Connie, Julia and Rami. This is Phelan, I hope I'm pronouncing your name correctly, Phelan Lewis. I'm a PhD student researching young adult caregivers and identity development. They thank you very much for all your work, particularly Rami's research study. And the question is, have you all screened or come across youth caregivers presenting with self-harming behaviors?
So I'll go ahead and respond to that. In my experience, I have not. I have referred one individual to social work, only because their screen had been positive, their depression and anxiety screen. I'm not sure if Dr. Siskowski has more experience in that area.
Over the years, among over 1,100 students, we have maybe seen one, but you know, when the kids have a sense of purpose and feel valued and recognized for what they're doing, it tends to decrease that need to self-harm.
I guess I want to mention also that in a Canadian study, there was a focus group of adults who were caregivers in their youth, and one of the main issues that they identified was the issue of isolation, of being socially isolated. The fact that no one was really identifying or recognizing the role that they're performing. And the truth is if you speak to some of these children, during the weekdays they may perform 2 or 3 hours, but on the weekends it's easily 2 times that amount, just kind of based on our pattern. That the weekend hour services are can be much more, up to 8 hours, even more.
Yeah, and really for our program, in order to be eligible, we have 5 levels of responsibility, and kids have to be in the top 3 levels. So that typically means that they're doing at least 20 hours a week and at least assisting with 1 ADL.
So you can imagine if that role goes under-recognized, the type of psychological impact it's going to have on someone who identifies as being a caregiver but hasn't necessarily been recognized, externally recognized as such, and moreover hasn't been praised for work.
Right.
And that's really goes back to just the critical importance of asking these simple questions. If there's anyone else caregiving for patients at home,
we can't let them feel alone any longer.
No. Well, I'm sorry to have to cut this off. It's been a great webinar presentation. Thank you all. Thanks everybody for attending, and I really appreciate it if you would just take a few minutes to complete the survey that you're going to be receiving. And thanks to our fantastic presenters, Julia, Connie and Rami, and all the amazing work that you're doing. So signing off. Have a wonderful day, everybody. Bye-bye.
Thank you all.